19 days after you were conceived, your heart began to beat, which began a lifetime of critical function, oxygenating and moving blood around 60,000 miles of blood vessels in your body. But it's more than just a pump that serves a purpose. It's an organ of your body that has been deeply associated with emotions for thousands of years. Hence the myriad of expressions we use regarding it, things like, "My heart swelled with pride," or "I was broken-hearted." The Egyptians talked about it in their hieroglyphs. They regarded it as a sacred vessel that could be weighed up by the gods to see whether or not truth was in it. And we're admonished in the Bible, in the book of Proverbs, to guard our hearts, for everything we do flows from it. So today I want to talk about how we can guard our hearts on an emotional and a physical level, and in turn increase our healing, our longevity, and our energy. Your heart is centrally located within your body, and a portion of it extends into the left side of your body. That's your left ventricle, and it's about the size of your fist. The right side of your heart receives blood from your body and pumps it into your lungs, and the left side of your heart does the exact opposite. It receives blood from the lungs and pumps it out into your body. The heart and your lungs, they work together as a team. The heart pumps blood to the lungs to pick up oxygen, and then picks up the oxygenated blood and pumps it out to the rest of your body. After all the oxygen has been delivered to your body, it picks up the carbon dioxide and brings it back to the lungs to drop it off so that it can pick up more oxygen. Before each beat, your heart fills with blood, and then its muscles contract and they push the blood along. Now your heart is made up of 4 different blood-filled chambers, 2 on each side of your heart. The top 2 chambers are called your atria, and the bottom 2 are called ventricles. And the atria and the ventricles work together as a team. The right atria fills up with blood. It goes through your tricuspid valve and into the right ventricle. From there it gets pumped through the pulmonary valve and the pulmonary artery into the lungs to get loaded up on oxygen. After that, the oxygenated blood enters the heart from the lungs, through the pulmonary vein and into the left atrium. It goes through the mitral valve and into the left ventricle. And after that, it goes through the aortic valve and out through the aorta into your body. That blub-dub sound that you hear when you're listening to somebody's heart are the valves closing as the blood passes through. The lub sound comes from the mitral valve and the tricuspid valves closing, and the dub sound comes from the aortic and pulmonary valves closing. Now, we can't talk about your heart without thinking about your blood vessels, your blood, lymph and lymphatic vessels, and your glands. They're all part of this very intricate system that makes up your circulatory system. The picture that you can see here shows a depiction of your heart, the major veins, and the arteries that are constructed from body scans. Now, veins take blood to the heart, and arteries take blood away from the heart. You have approximately 5 liters of blood in your body and approximately, wait for it, 25 billion red blood cells. They live a lifespan of up to 3 or 4 months. Your body puts 2 million new mature red cells into circulation every single second, and it takes about 1 minute for a red blood cell to go from your heart through your entire bloodstream and return to your heart again. At the beginning of this presentation, I told you that you have 60,000 miles of blood vessels in your body that carry your blood throughout it. Now, arteries and veins are 2 types of blood vessels. They're constructed of layers, which you can see here in this picture. The innermost layer, or endothelium, is really quite resilient, but it is prone to damage when the bloodstream becomes too acidic. And that's where arterial plaque and cholesterol deposits and scar tissue can form. The middle layers are called the tunica media, and they are layers of smooth muscle that work a lot like your digestive tract with a sort of peristalsis. That means they contract and relax to increase or decrease blood pressure as they move the blood along. Those muscles are ruled by your autonomic nervous system. That means that often when you're in a parasympathetic rest or digest state, the muscles will relax and your blood pressure will start to drop. but when you're in fight or flight mode and under stress, they can contract and your blood pressure will go up. By the way, blueberries are one of the best foods for your blood vessels, as is vitamin C. If someone is prone to bleeding gums or easy bruising, then they may well be low in their vitamin C levels especially. Now, blueberries are a great source of vitamin C, but they also strengthen your cardioconnective tissues. They lower blood viscosity, meaning that it can travel throughout your body without getting really sluggish. It lowers platelet aggregation, cholesterol, and inflammatory markers. And just half a cup a day is enough to make a massive difference. While we're on the subject of blood pressure, let's take a minute to talk about it and also your heart rates. If your heart rate is consistently over 80 beats per minute for people over 1 year of age, when you're resting, then your sympathetic fight or flight system is engaged. And it's okay for you to be over that rate if you're getting some exercise, but if it's under 80 beats per minute, then it means that your parasympathetic nervous system is active. That's optimal. The optimal number for that is under 70 beats per minute when resting. There are several factors that play into your blood pressure: the size of your blood vessels and whether or not you're tense or relaxed. The blood vessels will contract in fight or flight mode and increase your blood pressure, and relax during rest and digest and reduce blood pressure. We also need to consider the volume of your blood and its viscosity. So blood plasma is made up of salt and water. And if you have a lot, the blood volume is going to go up. And as a result, it will increase your pressure. If there are a lot of platelets or environmental contaminants, it's also going to increase your blood pressure. Your blood is made up of 92% water. And water follows sodium wherever it goes. So a diet high in salt is going to attract water to stay in the bloodstream and thereby increase your blood pressure. And that's why doctors put you on diuretics that help you to pee a lot, because when you pee and flush out the water, the salt follows it and your blood pressure will go down. Potassium is a natural solution to this problem because it counterbalances sodium. So when you increase your potassium intake, providing that you don't have any kidney or renal issues, the sodium and the water are urinated out, thereby lowering your blood pressure. Foods that are high in potassium are things like black beans and beets. They're bananas and leafy greens, winter squash, papaya, avocado, and almonds. To keep a healthy heart and healthy blood pressure, you should eat more potassium than sodium every day. So like I said, this means that you need to make sure you don't have any renal or kidney issues, but then your sodium ratio should be between 2:1 to 10:1. If you don't have any renal failure and you want to get your blood pressure down, then 10:1, which means you have 10 times more potassium than sodium in your diet, should be your baseline to get your blood pressure down. I want to take a moment right now and just introduce you to this amazing concept from traditional Chinese medicine, and that's the concept of energetics. It's the idea that we can see a connection between a group of elements in the body. We can group them into one of 5 elements, and then we can use it to see where there are potential signs and symptoms of dysfunction. Heart health is associated with the fire element. The organs that affect one another in this group are the heart, the small intestines, and the gland is the thymus gland. When those organs are experiencing some level of dysfunction, we start to see these negative emotions expressing themselves. The heart is synonymous with love pain, the heartbreak that we sometimes experience, feelings of being unworthy of love, joy, or happiness. Resistance to change, when your blood vessels won't change because they become stiff. In heart disease, you also become resistant to change and easily accepting of defeat. If someone gets really deeply hurt, then they might descend into blaming others or becoming hyper-controlling, feeling victimized, having negative internal dialogue, being irrational, vindictive, or judgmental. Now, these emotions help us to know that something is out of balance with either the heart, the small intestine, or the thymus gland. And there are also additional associations with this element. In heart health, you might also see red color or dots on the tip of your tongue, or a cracking and weak voice. Sweat has long been associated with heart health, and the inability to sweat is detrimental to it. And of course, as we would expect to see, our blood vessels are also connected. In a few moments, I'm going to share some beneficial heart health nutrients and herbs with you, but for now, I want you to see just one more connection. When you actually support your heart, your small intestine and your thymus gland with beneficial nutrients, supportive herbal remedies, and red bitter foods like hawthorn berry, amazing changes start to take place. When you start to heal, we start to see these positive emotional responses, such as stronger voices or feeling loved, satisfied, joyful, authentic, and enthusiastic. It's really fascinating and very cool. What I want you to see from this idea is that many things are connected. Your emotions are tied in with your health conditions, which are tied in with how your body responds to its struggles, like having a weak voice. Your anatomy, your physiology, your biochemistry, your energetics, and your emotions are all tied together and all impact one another. Also, because they're tied together, we can jump in with any one of these areas to help bring you healing. For example, supporting your small intestine actually in turn can improve the health of your heart. In the last few minutes that we have together, I want to share 6 things with you that are going to hurt your heart and 6 things that are going to help it. All right, let's take a few moments to talk about the things that really can hurt your heart. The first one would be smoking. Do you remember how your heart works? I said the right side of your heart receives carbon dioxide rich blood from your body and pumps it into your lungs so the lungs can get oxygenated, get pumped back into the heart and out to the body. So your heart is the second organ that is exposed to all the damaging chemicals that are inside a cigarette. Not many of us need to be convinced anymore of the dangers of smoking, but just in case you need to be reminded, cigarette smoke contains over 4,000 chemicals, including 43 known cancer-causing compounds and 400 other toxins. These cigarette ingredients include nicotine, tar and carbon monoxide, as well as formaldehyde, ammonia, hydrogen cyanide, arsenic, and DDT. Nicotine is also highly addictive. According to heart.org, cigarette smoking increases the risk of coronary heart disease by itself. When it acts with other factors, it greatly increases your risk. Smoking increases blood pressure, decreases exercise tolerance, and increases the tendency for your blood to clot. Arachidonic acid is an omega-6 fatty acid that we find in pork, beef, and fowl white meat. All animals make it naturally, including you and I. When we get sick or injured, our bodies start to produce inflammation in order to begin the healing process. That's really important. And that's where arachidonic acid comes into play. It's this beginning stage to healing. Now, it works well when we don't add more omega-6 fatty acids to our body than we need by eating animals that are sick or diseased or fats that contain a lot of omega-6 oils. Now, in America, our ratio of omega-6 to omega-3 oils is just way off. Most people are eating in the range of 20:1 to 50:1 instead of the recommended ratio of 6:1 to a 1:1 ratio. Arachidonic acid is essential for proper wound healing, but too much is going to promote these inflammatory conditions like arthritis, inflammatory bowel conditions, asthma, and eczema. Animals that are fed a better diet, that are finished humanely, they seem to have a lower percentage of arachidonic acid in their system. But when you couple your arachidonic acid with an animal's arachidonic acid, then you end up with too much of it, and then you combine that with cholesterol or saturated fats, and it becomes especially problematic for your heart, for your liver, for your blood vessels, heck, your immune system, your kidneys, your feet, your hair, your eyes, your moods, and your interaction with one another. Saturated fats will elevate your cholesterol levels, especially LDL, which is the bad type of cholesterol. But we need cholesterol in our bodies. It's essential for the formation of our hormones, our cortisol, our DHEA, which is the fountain of youth, and for aldosterone, which actually helps us to maintain our blood pressure. And it's also useful for converting vitamin D3, sunshine into vitamin D3 in our bodies. It can be really good when it's found in coconut oil, for example. It's a very good thing for vegetarians to eat and vegans and anyone with low cholesterol and adrenal fatigue issues. They could be just too low on their cholesterol levels. But it isn't so great for omnivores with a moderate to high consumption of meat and elevated cholesterol levels from the meats that they eat. Like I said, we do need cholesterol, just not in excessive amounts. In a meta-analysis study, 223 is the magic number. Any higher or lower than that, and the risk for our mortality increases. And we certainly don't need our saturated fats from poor and polluted sources like confined animal feed operations. If you have excess amounts of cholesterol in your body, then you have something called foam cells that are part of your immune system, and they help to clear away the excess. Now they can get weighted down by all the cholesterol that your liver and gallbladder can't get out as it's carried through your blood vessels. And what happens is they end up crashing into the blood vessel wall, and when they do that, they leave this long streak in the blood vessel wall. And that embedded cholesterol, once that damage has occurred, then more and more cholesterol can build up there, and eventually it ends up just blocking the entire artery. Cholesterol damage forms plaque on the blood vessel wall that prevents the blood flow, and it also prevents the blood vessel from dilating and expanding when it needs to. In turn, increased pressure forces the heart to work harder to get the blood through the circulatory system. If you have elevated cholesterol, then you should cut back on your saturated fats. You should increase your unsaturated fats. Increase your omega-3 fatty acids. It's going to help lower your total cholesterol and create this better balance of LDL to HDL. Regardless, omega-3 essential fatty acids are needed to keep the percentage of HDLs, which are your good type of cholesterol, high. And then another thing that can really help if you have elevated cholesterol are oats. They are a fantastic source of a type of water-soluble fiber that binds to cholesterol and carries it out of your body. By the way, fats get a really bad rap for causing heart disease, and while that is certainly true of trans fats and excessive amounts of saturated fats, sugar is also a massive culprit in lowering good cholesterol and raising your heart-damaging triglycerides. The sugar industry has worked very hard throughout the years to make sure that we focus on fats as the culprit, and we often fall prey to lowering fat levels too far and taking statins to lower our cholesterol without actually addressing the amount of sugar that we're consuming. All of your blood pumps through your heart. So infections in your blood can be really, really hard on it. And one of the ways to prevent infections is by making sure that you take care of your cavities with mercury-free fillings. The teeth and the gums create this essential barrier that keep the infections out of your bloodstream. Any opening into those tissues, including through cavities, is a breach of your immune system. The enamel erodes, then the pulp of the tooth, and that exposes the blood vessels in your tooth that should ordinarily be protected. This can take place under the gum line as well. So you need to make sure that you're cleaning your teeth frequently, flossing, using a water pick, and seeing your dentist for a cleaning every 6 months. Be very careful to avoid any harsh fluoride-filled dental products that really damage the healthy bacteria in your mouth. Over 1 billion pounds of pesticides are used in the United States every year, and approximately 5.6 billion pounds are used worldwide. In many of the developing countries, programs to control exposures are absolutely limited or non-existent. And those pesticides are used in farming because they are designed to kill the bugs that destroy the crops. But they are also used in your homes every time we use pest control, and they come out and spray your place. And we're exposed to them everywhere we go because pest control is used in most of the public venues that we go to. The problem with them is that they're designed to stop the muscles in a bug's heart and lungs from doing their job, which ends up suffocating the bug and giving them a heart attack. When we eat produce that is sprayed with pesticides and breathe in air that is exposed to all those toxins all the time, then our body is processing them as well. And these environmental pollutants are fat soluble, so they tend to get stored up in our fatty tissues. As our exposure builds up, we're subjected to the same effects on our hearts and lungs too. So anyone who is dealing with any kind of heart or lung disease should be planning on eating an organic diet, which drastically reduces the amount of pesticides that their body has to process. The last thing that's really bad for your heart is stress and anger. David Patterson is a doctor and a professor at Oxford University, and he studies heart and brain health. And he has shown that your heart and your brain work together to produce your emotions. You actually have neurons, which are similar to the ones inside your brain, located primarily around the right ventricle of your heart. They are closely connected, and they create this symbiotic emotional whole. In his documentary of Hearts and Minds, David Malone determines that the heart is a pump that responds when the brain asks it to. But it's not enslaved to the brain. Its relationship to your brain is more like a marriage, with each one dependent on the other. It seems that science is now restoring to the heart something that rightfully belongs to it, our emotions. Dr. McCullough notes that the interplay between your brain and your heart can be seen when looking at how your emotional and mental outlook colors your health, especially your heart health. Intense anger, for example, boosts your heart attack risk by 5 times and your stroke risk by 3. Intense grief after the loss of a loved one raises your risk of having a heart attack. The day immediately following the loss, your risk of a heart attack goes up by 21 times and remains 6 times higher than normal for several weeks. Conversely, if negative emotions have the potential to harm your heart, it would stand to reason that positive emotions may help heal it, and that indeed seems to be the case. In a study of nearly 1,500 people with an increased risk of early onset coronary artery disease, those who reported being cheerful and excited and relaxed and satisfied with life and full of energy had a 1/3 reduction in coronary events like a heart attack. Those with the highest risk of coronary events enjoyed an even greater risk reduction of nearly 50%, and that was true even when they counted in all the other heart disease risk factors such as smoking, age, and diabetes. Do you remember the fire element that I showed you at the beginning? It turns out that anger is the result of a different element, your wood element, being disrupted and your liver being overwhelmed. So when you work on having a healthy liver, then your heart will be positively impacted. I hope you can see that when we start to get one thing in order, it has benefits all over the body. So what's good for your heart? Well, the first and most obvious answer that you probably all already know is exercise. But do you remember that the fluid that's associated with heart health is sweat? So when we combine the two, we ideally want somebody to be working out or exercising for 30 minutes after they first begin to sweat. The formula 220 minus your age times 0.5 will give you the ideal heartbeats per minute that you need to experience to get your heart pumping into a cardiovascular range for your heart health benefit. So if you were 80 years old, then we would formulate that by saying 220 minus 80 times 0.5 to give you 70 beats per minute to get you into that cardiovascular benefit range. The best thing you can do, though, is work with a fitness professional to help work out a safe exercise program that is specifically designed for you. Saunas are also really good for the heart because they induce sweating. A study called The Beneficial Effects of Sauna Bathing for Heart Failure Patients said, although sauna bathing causes various acute transient, cardiovascular, and hormonal changes, it is well tolerated by most healthy adults and children. Some studies have suggested that long-term sauna bathing may help lower blood pressure in patients with hypertension and improve left ventricular ejection fraction in patients with chronic congestive heart failure. Contraindications to sauna bathing include unstable angina pectoris, recent myocardial infarction, and severe aortic stenosis. However, sauna bathing is safe for most people with coronary artery disease, stable angina pectoris, or an old myocardial infarction. Very few myocardial infarctions and sudden death occur in a sauna, but alcohol consumption during a sauna bathing actually increases the risk of hypotension, arrhythmia, and sudden death, and should absolutely be avoided. Now, there is not one single healing process where clinical nutrition is not a viable primary therapy for healing. Your heart is going to benefit if you change your diet. So what should you include? The first thing is mitochondrial nutrients. We've talked before about the importance of taking care of your mitochondria with regards to your heart. This is absolutely no different. In fact, your heart has one of the highest concentrations of mitochondria in your body, so it's really important to take care of them. For healthy mitochondria, you need oxygen, clean organic foods, vitamin B complex, alpha lipoic acid, coenzyme Q10, acetyl L-carnitine, magnesium, iron, sulfur, copper, and porphyrin rings from chlorophyll, which is just the green in our green foods. And while we're talking about green foods, here is a reminder that at the center of your heme molecule in human blood, it has nearly the same structure as the center of a plant's chlorophyll. The biggest difference between the two is that iron is at the center of a heme molecule and magnesium is at the center of chlorophyll. The chlorophyll helps to build your blood and keep it clean, which in turn is going to keep your heart really, really healthy too. Vitamin B12 and folic acid are vitamins that are necessary for healthy blood too. They help to prevent anemia and they allow your body to carry the oxygen where it needs to go. It's very hard to get enough vitamin B from food alone, so supplementing is not a bad idea. B12 is found in sardines, salmon, tuna, cod, lamb, scallops, shrimp, beef, and organic dairy. And vitamin B9 is found in lentils, pinto beans, garbanzo beans, asparagus, spinach, navy beans, black beans, kidney beans, turnip greens, and broccoli. Fatty acids have the potential to either cause inflammation or reduce it. And fats go straight from your digestive system to your heart for fuel. So I don't have any time left today to go into the details about how all that works. But I do want to remind you today that the type of oils that you use and when you use them makes this almighty difference to the health of your heart. In the Western diet, we eat too many inflammatory omega-6 oils which promote disease and not enough omega-3 oils to bring balance to our body and decrease inflammation. It's believed that we should eat omega-6 and omega-3 fats in a ratio of 1:1, but in our diets in America, it's more like 15:1. I'm going to have a handout that you can use that is good for figuring out which oils are the right ones for the right jobs in the kitchen. And so if you want that, just reach out to me with the contact information on the slide and I'll be happy to email that to you. If you want to increase your omega-3 oils, consider including flaxseed as long as you don't have any serious thyroid troubles, salmon, chia seeds, and walnuts. To know how to avoid or reduce your omega-6 oils, look for grapeseed oil, sunflower oil, corn oil, wheat germ oil, soybean oil shortening, and margarine. Vitamin C is essential because it makes your blood vessels more pliable. The daily optimal dosage is 3,000 to 5,000 milligrams per day or until bowel tolerance. If your tummy gets upset, then you know you've had a little bit too much vitamin C. It's also an antioxidant that helps regenerate heart-healthy vitamin E, and it helps to improve your immune performance. So foods that are naturally high in vitamin C are things like papaya, bell peppers, and broccoli. And you can supplement with vitamin C too. Vitamin E is an antioxidant that also improves the pliability of your blood vessels and thus improves your cardiovascular system. The optimal daily dosage for vitamin E is 400 to 600 IU's daily, and good sources of vitamin E include sunflower seeds, almonds, olives, and kiwi. Hawthorn berry is a plant that is commonly used to resolve heart issues. It strengthens heart function, it improves oxygen availability to the muscles, it improves the efficiency of heart contractions, it even eases breathing during asthma, and it lowers your blood pressure. So dosing is typically around 250 to 500 milligrams per day. Now it's a great herb if you feel like life has left you overworked in relationships, family, even the pursuit of your dreams. Along with rest, healthy oils, and sweating, it can really help to conserve energy by slowing you down and helping you to focus on one thing at a time. It's like a hug in a bottle that reassures your body that everything is going to work out just fine. But it can interact with a few of your medications. So if you're on any heart medications already, I'd encourage you to speak with your pharmacist or a doctor or a nutritionist or naturopath and find out whether or not hawthorn will interact with the medications that you're already taking. Ginkgo biloba helps with brain function and blood circulation. One study in people with heart disease who supplemented with ginkgo revealed an immediate increase in blood flow to multiple parts of the body. That was attributed to a 12% increase in levels of circulating nitric oxide, which is a compound responsible for dilating blood vessels. Additional research also pointed to ginkgo's protective effects on heart health, brain health, and stroke prevention. And one of the reasons why that may be so powerful is because of all of its anti-inflammatory compounds which are present in the plant. The recommended dose is 120 to 240 milligrams divided into several doses throughout the day, and it might take up to 6 weeks for you to notice any effect. And again, it could interact with blood thinners, so make sure you talk to a health professional before you start taking any new supplements. Heart disease is the #1 killer of Americans, and there are certainly things that we can do to prevent it and protect our hearts, whether it's through diet or protecting our emotions. So think about it and decide whether or not you might benefit from a sauna or some exercise or quitting smoking. Perhaps you need to just include half a cup of blueberries in your diet every day. Think about how you're using your oils and whether or not you need to switch to organic foods. Consider reducing your stress and breathing a whole lot more. All of these things are going to contribute to your heart health and your emotional well-being. So what are you waiting for? There is absolutely no time like the present to get started.